So as you age, I think it's really important to see why you are aging. There are three kind of components to the face. That's really how I look at it. First component is skin quality. And I think skin quality is something you should start working on that now. If you're 20 and you're watching this video, get on it. If you're 50 and you're watching it, get on it. There are medical grade things that you can do to help with skin quality. I'm a huge fan of niacinamide, which helps your skin quality, helps with pigmentation, and actually helps prevent skin cancers. Huge fan of retinol and Retin-A, which you can't do if you're trying to procreate or if you're breastfeeding, but otherwise I think it's a great thing to be on. Microneedling I think is an awesome thing to do, and in our clinic we do that with exosomes, which are stem cells, which really help with the skin quality, so fine lines and wrinkles and things like that. So step one is skin quality. Step two is volume. And as you age, you lose facial volume. And this has nothing to do with your body weight, though for a lot of the people who are going through major weight loss, they're starting to lose more volume in their face. And so that accelerates your aging. And the way to get volume back is by adding filler in the office. So things like Juvederm, Restylane, Voluma, or in the operating room, I use your own body fat. And I centrifuge it and I actually inject it into the face. So I'm replacing what you lost with what you need, which is your own body fat. Facelift is to tighten the skin. And so that really, a facelift is always something that kind of affects you from here to here. Eyelid surgery is a different part. And so facelifts for me now tend to be later in life. Because I can fix most of facial aging up until probably the mid-50s with doing things like eyelid surgery and fat grafting where I'm adding volume, and it kind of has delayed doing a facelift. But if you need to tighten the skin, that is what a facelift does. So when you come in, we'll analyze your face and we'll look at what is the component of skin quality. If your skin is wrinkled and the sheet doesn't look good, even if the sheet is the right size for the bed looks bad. And that's because the sheet quality needs to be improved. The second thing is volume. And as you lose volume, your face kind of falls. So putting in volume will kind of lift things up. I always have patients that worry that they don't want to look like a housewife or that kind of fake look that looks very done. And you can do fillers and volume in a very subtle, beautiful way where you just look refreshed, or love your haircut, or that shirt looks great on you. And those are people saying, I like your filler, but they don't know that that's why you're looking fresher. And I think filler is an awesome thing to do for that. Again, I love fat grafting because it's adding your own body fat. Whatever fat survives can be there for years, so it's going to have a longer lasting impact. And it has stem cells in it naturally, which improve the quality of the skin. So fat grafting is kind of a twofer where you get volume and skin quality improvement. And then you get into doing things where you tighten the skin. If your eyelid is hanging into your eye, you have to take out the extra skin. That's a blepharoplasty, that's a surgery. If you're really loose along the jawline or in the neck, again, that skin looseness, you've got to tighten the skin. You don't want to overfill the face to try to correct looseness, because that gives you that really kind of round face that looks really fake.